Hello and welcome to a discussion on the pelvic walls. So the pelvic walls are basically formed by bones and ligaments that are partly lined with muscles covered with fascia and parietal peritoneum. Right. So you have an anterior pelvic wall, a posterior, a lateral, and a floor, which basically becomes the inferior pelvic wall. The anterior pelvic wall is the shallowest and it's formed by the bodies of the pubic bones, the pubic rami, as well as the symphysis pubis. The posterior wall is quite extensive and you find the sacrum and the coccyx, which are part of the vertebral column. And the muscle there is going to be the piriformis with its covering parietal pelvic fascia. Then on the lateral pelvic wall, you find the hip bone below the pelvic inlet. Then you also expect to find the obturator membrane, the sacrotuberous and sacrospinous ligaments. Then you also expect to find the obturator internus muscle and its covering fascia. Right. The pelvic floor has the pelvic diaphragm, which is made up of the levator ani and the coccygeus muscles, and they're covering fascia. And it separates or divides the cavity into the main pelvic cavity above and the perineum below. Right. Then if you look at the membranes and the ligaments, there's the obturator membrane, which is a fibrous sheet that covers the obturator foramen, but it doesn't cover it completely. It allows for a very small gap that is going to be left there, which is going to be the obturator canal. Within the obturator canal, you expect passage of the obturator nerve and the obturator vessels as they gain access into the medial compartment of the thigh. Right. Then the ligaments, you're going to have the sacrotuberous and the sacrospinous ligaments, which are strong and triangular shaped ligaments that are actually going to convert the greater sciatic notch and the lesser sciatic notch into foramina. Right. The sacrotuberous ligament will extend from the sacrum and the coccyx as well as the posterior inferior iliac spine all the way to the ischial tuberosity. Whereas the sacrospinous ligament will attach to the spine of the ischium as well as the coccyx and the lateral part of the sacrum. Right. And the muscles that you find, the piriformis muscle is the one that we said is on the posterior pelvic wall. It arises from the lateral mass of the sacrum that leaves the pelvis via the greater sciatic foramen to enter the gluteal region. It's going to be one of the small lateral rotators of the hip, which are found in the deep gluteal region. And in terms of its nerve supply, it's innervated by the sacral plexus. As the piriformis passes through the greater sciatic foramen, it actually divides it into an upper compartment as well as a lower compartment. The upper compartment will provide passage for the superior gluteal vessels as well as the superior gluteal nerve, and everything else that is then going to pass through your greater sciatic foramen will pass below the piriformis to include the sciatic nerve. You also expect the nerve to the quadratus femoris, the nerve to the obturator internus. You also expect the posterior cutaneous nerve of the thigh. You also expect the inferior gluteal vessels as well as the inferior gluteal nerve itself. Right. Function-wise, it's one of the small lateral rotators of the hip. Other small lateral rotators will include the obturator internus that I'm going to mention next as the muscle on the lateral pelvic wall. You also expect to find the gemelli superior and the gemelli inferior. And you also expect to find another muscle known as the quadratus femoris. Right. Then on the lateral pelvic wall, there is obturator internus. It arises from the pelvic surface of the obturator membrane and parts of the adjoining hip bone. And the muscle fibers leave the pelvis via the lesser sciatic foramen. And the tendon of this obturator internus is going to turn 90 degrees as it goes to insert onto the greater trochanter of the femur's wall. Function-wise, it's going to be a small lateral rotator of the hip, just like the piriformis, and the nerve supply will be the nerve to the obturator internus, which comes from the sacral plexus. Right. Then the pelvic floor consists of the pelvic diaphragm, which has the levator ani and the coccygeus muscles. and they're covering fascia. The coccygeus muscle is a small triangular muscle that arises from the ischial spine. It inserts into the lower end of the sacrum and the coccyx. Right. It assists the levator ani in supporting the pelvic viscera. So basically, the pelvic diaphragm, function-wise, it supports the pelvic viscera. The nerve supply of the coccygeus will be a branch from the fourth and the fifth sacral nerves. Right. Then if you look at the levator ani, the origin of the levator ani is it has a linear origin from the pelvic surface of the body of the pubis, a tendinous arc of the obturator fascia, as well as the pelvic surface of the ischial spine, and it inserts into different parts. It's actually going to have 3 parts. The anterior fibers form a sling around the prostate in the male. That is going to be the levator prostate. Then in the females, they form a sling around the vagina, which is going to be the sphincter vaginae. The intermediate fibers are going to be the puborectalis, and they form a sling around the anorectal junction, which is to be inserted into your anococcygeal raphe. The puborectalis will form part of the anorectal ring, which is also going to be composed of the deep and the superficial anal sphincters, right? Then the posterior fibers will be your iliococcygeus, and they insert also into the anococcygeal raphe and the coccyx, right? Then you also have pubococcygeus on the intermediate fibers that go to the anococcygeal body. Function-wise, they support and maintain the pelvic viscera, and the nerve supply is the perineal branch of the fourth sacral nerve, as well as branches that come from the pudendal nerve. Right. Then injury to the pelvic diaphragm may, in parturition, or when you actually tear the perineal body, will result in difficulty in delivery, right? And can no longer provide support for the pelvic viscera, which may lead to organ prolapse, like uterine prolapse. You also expect rectal prolapse, right? Right. Then there's the pelvic fascia. The pelvic fascia is formed as a continuation with the fascia that lines the abdominal wall, right? In particular, the parietal layer is a continuation of the fascia transversalis from the anterior abdominal wall. And in the pelvis, it's going to have different names depending on what it covers. For example, you have obturator fascia, which covers the obturator internus. You have the fascia covering piriformis. You have the fascia covering your pelvic diaphragm, right? Then in the perineum, it covers the sphincter urethrae, the perineal membrane, and it also forms the superior fascial layer of the urogenital diaphragm. Then the visceral layer is simply a condensation of the loose areolar tissue that is around the pelvic viscera as well as blood vessels. It's quite loose and thin. Right. Then in certain locations, this visceral layer would thicken and it forms fascial ligaments. For example, the pubovesical and the sacrocervical ligaments. Right. That's just about it. Thank you.